Our next speaker is Malcolm Stamp, who's the Chief Executive of Metro North Hospital and Health Service. He has over 39 years experience in the UK at the NHS over there, and has also worked in New Zealand as the Chief Executive of one of the health boards there. So we are really lucky because we know in both of those countries the maternity models, the midwifery models of care are very strong, so I think we have lots to benefit from that experience. He has 2 daughters and it says it's a keen football follower. It doesn't say what code, but being in a leagues club, we better not say it might be in any of the others. Please welcome Malcolm.
Good morning. Thank you for the invitation and thank you for the kind words, Minister, earlier on. It's good to be here. I recognise some familiar faces. It's a bit like the Minister, I'm not quite on GPS yet, but there's a number of you who come to see me regular, and it's good to see you here today. The last time you came to see me there were no babies, so hopefully you'll get that right next time, because we always enjoy seeing the little ones. Metro North, as the Minister already said, is developing a service delivery model that will create a women's and newborns service stream that will operate across our whole hospital and health service and all our facilities. This service hopefully will deliver a coordinated specialist service that will continuously improve access and enable a consistent approach to the delivery of high quality care for all women. It will also provide the opportunity for a Metro North-wide approach to enhance the work we've already started around improving patient engagement in the developing of our services and the determination of priorities. We recently launched a new private practice midwifery model of care for the Royal Brisbane and Women's Hospital patients, giving more choice to Northside families. This agreement is the first of its kind in a public hospital in Brisbane. This programme has been the result of many years of planning and input from many of you in this room to provide another alternative for women wanting to see their own private midwife. This first phase allows women to see an accredited private midwife in the community during their pregnancy and after the birth. Currently, they attend the Royal Brisbane Women's Hospital for the birth as a public patient under the care of our staff. Women can also access specialist appointments from the Royal Brisbane Women's Hospital as required. In the future, we intend to transition to a full continuity of care where midwives have visiting access to attend their private patients for birthing. This is a demonstration of our commitment to connect patients to high quality care through developing strong partnerships with other health provider partners for integrated care models. We are also involved in the National Partnership Agreement on Indigenous Health, where at a state level we have been part of the development of mental health wellbeing tools and training for Indigenous health workers to check the mental health of Indigenous patients. In Metro North, we are also running an Indigenous programme at Caboolture and Redcliffe, which with a focus on the provision of one-to-one care for Indigenous mothers through their entire pregnancy. I'd like to thank and acknowledge the work of Associate Professor Rebecca Kimball, who is based at the Royal Brisbane, and many of you will know her already. Rebecca has been chair of the statewide Maternity and Neonatal Clinical Network since September 2010. She has also founded and established the Queensland Clinical Guidelines Programme, which has had statewide engagement from clinicians, policymakers and consumers to develop and implement the translation of evidence-based maternity care across the state. Hopefully our learnings from that work will be applied across many other specialties beyond maternity. I'd just like to confirm that I am an avid football fan, so I concentrate on the Champions League and the Premier League. All this other stuff, this funny shaped ball, I don't understand at all, but I'll get used to it. Thank you very much indeed.